Empire Broadcasting Group is pleased to present Dr. C. Norman Shealy.
I am Dr. C. Norman Shealy. I am by training a neurological surgeon. But during my residency in neurological surgery, I realized that what we were doing to treat people with chronic pain that had not responded to the initial treatment was, in my opinion, barbaric. We were cutting the spinal cord or destroying the frontal lobes. So I spent the next 3 years after my residency doing research on pain physiology. And I developed something called transcutaneous electrical nerve stimulation, or TENS, which is excellent for controlling local pain. For instance, shoulder, you could put an electrode above, below, on either side of, and it will often control the pain. Or on the back, you don't put it over the pain, around the pain. And you turn up the electricity, and it numbs the area. On the other hand, there are all kinds of other things that won't respond to that. There's deep pain or widespread pain. And then, of course, people who have chronic pain that has not responded to conventional medicine become depressed and anxious. And that's the major problem often that I see. Interestingly, just this week, I worked with a gentleman whom I first saw in 1979 with chronic back pain after multiple surgeries. He's done well for all these years. Then he developed new pain in his neck, and he came back for 5 days of intensive work with me. And that's the kind of thing that I have done now for the past 60 years. I work with people who fail conventional medicine. Now, in my opinion, conventional medicine is excellent for acute illness. And conventional medicine, well, it's inadequate or even dangerous for most chronic diseases. There's no circumstance under which I would accept the usual conventional treatment for hypertension, for heart disease, for depression, for anxiety, and probably even for cancer. I look for things that are safe and truly useful. Now, I have worked in my post-training period first as a neurological surgeon, and I enjoyed surgery. But then I looked at all the failures, and I began working with hundreds of people every year who had failed unsuccessful back surgery, and then it spread into everything else. And so in 1971, I subspecialized in chronic disease and founded the American Holistic Medical Association in 1978. I continued to work with patients who were failing conventional medicine. Now, I give lectures all over the world. I do probably 20 or more trips a year where I talk to people who are interested in my message. I do webinars at least once or twice every month, of internet type stuff. And of course, I have 3 radio programs that I do. One here in Springfield will soon be 29 years. So my work is to tell people what's available and to help those who are ready to come.
When did you realize you wanted to be a doctor?
I knew at age 4 that I wanted to be a physician. All my life, I wanted to help people. I went to medical school when I was 19, and I've never lost my passion for helping people. In my belief system, there's only one purpose for being on the face of the earth, that's to help people. Now, I think everybody who has a job and does it with some kind of pleasure, if you will, and a positive attitude is doing as good a job as I do. I just happen to focus on people who have not done well with conventional medicine because I enjoy helping them recover.
Where did you receive your education?
Well, I went to Duke undergraduate school when I was 16, medical school at Duke when I was 19, and then I did 7 years of post-medical school training in basic surgery and neurological surgery. I spent 3.5 years on the faculty at Western Reserve Medical School, have taught at a couple of other medical schools, but been in private practice all of these years.
What is your golden rule when treating a patient?
My policy for all of my life since 1971 is I do not do any approaches that I consider dangerous. Of course, I don't do any surgery anymore. I don't recommend drugs anymore. And those are the ones that carry the greatest dangers. You know, like 225,000 people die each year because of drugs or surgery.
Who has inspired you during your career?
Over the years, I have, of course, met many, many wonderful people around the world. For the last 34 years, I've worked with Dr. Carolyn Mace, who is the world's best-known medical intuitive. And I've worked with another group of people like that. I think I respect a lot of people, including a number of physicians and a number of alternative practitioners.
What are your secrets to success?
I think intuition, imagination, and enthusiasm.
What was your childhood like?
I often say I did not have the courage in this life to choose abusive parents. So my childhood was carefree, if you will. I was always encouraged, and I feel very sorry for people who have been abused, neglected, ignored, etc. I think it is important that children should be brought into the world when you want them and cared for and nurtured until they're at least grown.
What makes your practice unique?
I think the most unique part of our practice is that we really are holistic. We look at the patient physically, mentally, emotionally, and spiritually. I always take at least 1 hour with a new patient. I don't see how anyone can, in even 15 minutes, let alone 7 minutes that many physicians use, I can't even get started in that period of time. I need to know what's going on.
May we see the TENS machine?
Yes, I'd really like to show, if I may, the TENS device that I began creating back in 1966. And if I could have that. I discovered this one in 1975. This was invented by an engineer named Saul Liss. It is the Liss cranial electrical stimulator. Here, the electrodes are placed on the head. And it's so safe you could drive your car while wearing it. Using this for 1 hour in the morning can restart what I call your bright-eyed, bushy-tailed wake-up hormone, serotonin. If you wake up ready to go for the day, the serotonin goes way up. Well, all people with depression and or anxiety, and most people with chronic pain, have an abnormal serotonin mechanism, among other things. So this is one of the greatest tools for resetting that particular biochemical thermostat, cranial electrical stimulation, which I introduced in '75. Now, I'm something of an electrical junkie. I've been working with the electrical system, because the brain is electrical, since I was in medical school. Over the last 5 years, I've discovered one other form of electrical stimulation called pulsed electromagnetic field therapy. And if you'll hand me the coil now. I developed this particular one. I have worked with several pulsed electromagnetic field devices, one costing $18,000, which wasn't half as good as this one. This actually puts out the frequencies of the human chakras, the energy centers of the body. The first chakra, the legs, physically resonate, if you will, with Earth frequency 7.83, the Schumann frequency. Each chakra adds 7.83, so you get up to the seventh chakra 7 times over. This sweeps through the 7 chakras every 12 minutes. It starts over again. You can put it anywhere in your body. Your whole body, head to toe, is getting those particular frequencies. Totally safe. You can wear it 24 hours a day. The only contraindication, I wouldn't do it in pregnancy because you wouldn't use most electrical things in people who are pregnant, and I wouldn't use it with a cardiac pacemaker. It won't hurt you, but it might interfere with the pacemaker. Other than that, totally safe. Great for pain relief, great for mood, and I think it really helps the entire physiology, the chemistry and electricity of the body as a whole. So I consider this my most important current development. Now, going back, however, there's one other aspect of my work that I also consider critically important. In 1972, as I was beginning to get started in trying to retrain people who have failed conventional medicine, I learned about something called autogenic training and biofeedback. Autogenic training has been around since 1912. By 1969, there were 6 volumes published on the benefits of autogenic training. 80% of people with all stress diseases are made better with autogenic training. My arms and legs are heavy and warm. My heartbeat is calm and regular. My breathing is free and easy. My abdomen is warm. My forehead is cool. My mind is quiet and still. Now, you do that for 15 or 20 minutes every day. It retrains the entire autonomic nervous system. 80% success in every known stress disease and all diseases of stress illnesses. Students do better, business people do better, athletes do better if they're trained with autogenic training. So that's why in 1974 I went back to get my PhD in psychology, because I wanted to understand this more. And I added to autogenic training something which I call biogenics. Biogenics means origin of life. And so I learned that first we need to learn to relax. That's critically important. But relaxation alone will not heal you unless you do certain other things. You need to get into contact with the parts of your body. In other words, every cell in your body has a feedback to your brain. And when people are stressed, that two-way street is blocked. So I developed a variety of techniques for teaching them how to get in touch with parts of the body that are stressed, where there's muscle tension, no awareness of what's happening in the body, talking to the body, imaging the body. You can actually train yourself to get rid of pain. In fact, one of my favorite techniques is to imagine breathing through your hand. Instead of breathing through your nose, you're breathing through your hand. Now, if you'll do that for 20 minutes, it will make your hand numb. Actually, in 1976, I went to the Philippines and I got a sinus infection. Never had one before or since. And I had to have surgery up through the nose, crushing the bone to get into my sphenoid sinus. I said to the anesthesiologist, okay, just give me 20 minutes and I'll be ready. I don't like anesthesia. I don't like drugs. And so 20 minutes later, I said, okay, I'm ready. I could hear the noise and feel movement, but I had no pain for an hour-long procedure. And that's how effectively you can train your body and mind. Now, you don't do it with an acute injury. You only do it when you know what's going on. But no matter how good you get at training your body and mind to work together, if you don't get rid of your unfinished business emotionally, it's going to set it off again. Now, to me, there are only 5 problems that people can have. They're all the result of fear. There's fear of death. There's fear of being an invalid. There's fear of poverty. Those are not that common, but they do occur. The 2 most common ones are fear of abandonment or loss of love. That's a biggie. And the other one is fairness and justice and the whole purpose of existence. I call it the existential crisis. And so you need specific exercises to learn to deal with those things where you have. Now, when I created the TENS device in the 60s, We were looking primarily at stimulating 1 to 100 cycles per second. And that works really well for reducing pain locally. Then in the mid-90s, I was invited, actually 1994, to the Ukraine to study what they call microwave resonance therapy. It turns out they discovered that human DNA resonates at 52 to 78 billion cycles a second. And you never lose that frequency, but you lose voltage, if you will, amplitude. And so I then created a device which I call gigatens, which puts out those frequencies. Now, this works much better than regular tens at 1 to 100 cycles. Because of those high frequencies, it can sort of recharge your DNA. And then I discovered 5 circuits in the body. I've been doing acupuncture since the mid-60s also. And I discovered 5 acupuncture circuits would have very specific biochemical effects. For instance, the single most common biochemical abnormality, perhaps, in people is losing DHEA or dehydroepiandrosterone. It is the most prominent hormone in the body. And as we age and get stressed, we begin to lose it. Most people optimize their production of DHEA at age 25. By age 30, they've lost 5 or 10%. Every known disease, physical, emotional, chemical, any way you want to look at it, is associated with low levels of DHEA. Taking DHEA is not wise. Using this device on 12 specific acupuncture points, which I call the Ring of Fire, I can actually significantly regenerate the body's ability to make its own DHEA. Now, the problem with that is it takes 20 minutes, and a lot of people will not spend the 20 minutes that are necessary. So eventually, 5 years ago, knowing that people weren't going to do it, I began to look at other ways of activating these 5 circuits, and I developed something which I call transcutaneous acupuncture. Instead of using needles, I use mixtures of essential oils.
How does that work?
If I'm doing an acupuncture, I just push it in, twist it, take it off, 2 seconds or less. So on the 12 points of the Ring of Fire, it can be done in a maximum of 30 seconds instead of 10 minutes. That's just one of 5. The next one, in order of importance, is for the Ring of Air. The Ring of Air is 13 specific acupuncture points. This raises oxytocin, the nurturing, the bonding, the love hormone. It is fantastic for depression and anxiety. 80% of people with those particular problems can be helped with nothing like this. 30 seconds. 30 seconds. Whoop. A wonderful tool. Then there is the Ring of Crystal. Crystal, on its 13 points, reduces free radicals by 80%. There's nothing in the world that comes close to that. Free radicals are the things that age us, essentially eventually kill us. They rust the body. This is the best known technique for reducing free radicals, 80%. Amazing. Then there's the Ring of Earth with Earth Bliss. This raises calcitonin, the strongest pain reducer the body makes, 4 to 6 times as powerful as morphine. And it keeps your bones from falling apart. The most common cause of death in those over the age of 80 is a fractured hip. This can help prevent that and reverse osteoporosis. And then the Ring of Water, and this is for edema or congestion, people who are not processing water properly. And again, it's 13 different points, 5 different oils, but there's nothing in the world as quick and effective as these. Now, the really interesting thing about these is 10 years ago, I began to recognize that part of the aging process is our telomeres, the tips of our DNA. Under the best of health circumstances, your telomeres shrink 1% every year of life. So we're sort of genetically predestined to die by age 100. Yeah, obviously a few people get beyond that. I have now demonstrated in almost 50 people that we can regrow the telomeres 3.5% every year of life. I've been working on this for 10 years. My telomeres at age almost 84 are 35 years younger than my age. And so in 1.5 minutes a day, just using fire, earth, and crystal, we can rejuvenate the telomeres and help produce healthier longevity. So I consider this my most important development to date.
Are there any videos of these treatments?
Yes, on my website are videos of me applying the bliss oils to each of the rings, so people can actually see it done on a video. And there are a few other videos. In fact, in 2006, I produced an 1.5-hour documentary, Medical Renaissance, showing the great advantage of the holistic approach to depression and pain.
How important is a partnership to your overall health?
Having a mate or a partner who is in sync with you is a wonderful adjunct. Obviously, joining with a friend or a partner is a great way to encourage one another. And then you get the bonding, the oxytocin, natural oxytocin of liking someone else. And that enhances the benefits.
This has been an Empire Broadcasting production.